I request Dr. Amulya Kanaki to present her paper on neonatal hearing screening.
Good afternoon, everyone. Today I am going to present a paper on neonatal hearing screening using otoacoustic emissions in a tertiary care center. Hearing is essential for the development of speech and language. Children with bilateral hearing loss frequently experience challenges in these areas which can hinder their educational progress. Early detection and intervention are crucial to mitigate these effects. The incidence of significant hearing loss among neonates ranges from 1 to 3 cases per 1,000 live births, increasing to 2 to 4 per 100 among infants who survive neonatal intensive care or those at high risk, including preterm infants, low birth weight infants, and those with family history of hearing impairment, hyperbilirubinemia, meningitis, in vitro infections, exposure to ototoxic medications, and mechanical ventilation lasting for 5 days or longer. As a result, neonatal hearing screening programs are recommended in developing countries. Tests such as otoacoustic emissions are necessary for early screening of newborns. In humans, the otoacoustic emissions are the sounds generated from the intact cochlea by oscillation, that is the contraction and elongation of the outer hair cells, and transmitted across the middle ear to the external ear, where they can be recorded by sensitive microphone and can be considered as a marker for inner ear integrity and the way to screen for hearing impairment. In our study, hearing loss occurring from birth to first 28 days is considered as neonatal hearing loss. The purpose of this study is to assess the incidence of early hearing loss in newborns using otoacoustic emissions. It is a prospective cross-sectional study done on the patient's 300 newborns within the first 28 days of life. Exclusion criteria include the newborns with severe multiple anomalies incompatible with life, atresia or stenosis of the external ear canals, and hearing loss associated with the syndromes. The study was carried out in the ENT department at Basveshwar Hospital in Kalaburgi, and the data was collected from May 1 to October 31st of 2024. Demographic, prenatal and postnatal informations were gathered by the comprehensive head and neck examination, and initial otoscopy was done. Otoacoustic emission testing was done as a part of neonatal hearing screening. It includes a positioning of a probe in the ear, measures the inner ear responses to the sound. The small flexible plug is placed in the baby's ear, emitting scientific sound stimuli. A tiny microphone in the plug records the otoacoustic responses, and the results are displayed as pass or refer. Statistical analysis was done. Results include, in our study, most of the patients, newborns were males, which includes 54.6%. Out of those, 7 had OAE refer, and females 136 newborns, out of which 5 had refer in the OAE. Only right ear was affected in 2 newborns, whereas left ear in 1. And bilateral ear showed refer in 9 newborns. Among the 300 patients, 120 newborns were high risk category and 180 were of normal newborns. Out of 120, 8 had OAE refer, and out of 180, 4 newborns had refer on OAE. Discussion: hearing loss is a hidden disability that does not attract much sympathy like other physical disabilities. Universal hearing screening represents the only way to identify neonates with hearing loss. Screening with OAE is a non-invasive, quick, simple and safe method of detecting hearing loss in the neonatal period. Once hearing loss is identified, effective treatment options are available which can secure holistic development in the child. There are certain factors which bring about the delay in diagnosis, which include low literacy rate and cultural consideration, doubts about the degree of hearing loss, and uncertainty about the benefits of hearing amplification, attitudes towards wearing hearing aids, and cost and technical considerations. In this study, OAE is used for screening the neonates. Out of 300 neonates, males were more, which is similar to the study done by John et al. And also study done by Suresh Rajkumar, whereas out of 1040 patients, 51 were females. In our study, the referral rates for males was 4.2% and for females it was 3.6% with male dominance, which is similar to the study done in Qatar that reported referral rate of 2.7% in males and 2.5% in females. Whereas some of the studies like done by Abdullah A. et al. Had more referral rate in females because the fact that the females were recruited more in that study. The total referral rate of 4% is obtained in our study with bilateral hearing loss being 3%, 0.6% in right and 0.3% in left ear. Other studies also have a referral rate of 8%, 8% with bilateral hearing loss. Some studies have a referral rate of 4.54% like Beckel et al. And whereas Chorus et al. Has a referral rate of 2.3%. The recognized risk factors observed in NICU are low birth weight, prematurity, congenital malformations, rhesus incompatibility, premature rupture of membrane, antenatal ototoxicity, and maternal febrile illness. In our study, referral cases in high risk neonates was more compared to the normal neonates. In a study done by Karman SC et al., the calculated prevalence of neonatal hearing loss was 5.2% in well baby nursery and 10.8 per thousand in NICU, which shows that referral rates are high in high-risk neonates. A hearing screening done by Nagapurna et al. Was conducted at St. John's Medical College, where they showed that incidence of hearing impairment to be 5.65 per thousand screen, 3 were at-risk infants and 7 not at-risk infants, which is contrary to our study. This shows that hearing screening should be done to all the neonates. Same thing was told by Joint Committee on Infant Hearing, that hearing screening should be done for high-risk neonates as well as the normal well-fed neonates. Conclusion: universal newborn hearing screening is essential in today's healthcare landscape. Otoacoustic emissions serve as an effective tool for screening newborns for hearing loss. This examination can be easily conducted in newborns regardless of their gestational age. These factors highlight the urgent necessity for establishing a comprehensive national program for neonatal hearing screening and addressing the preventable risk factors for neonatal hearing impairment in developing countries. These are the references for our study. Thank you.
Thank you.
Yes, sir. Yes, sir. Those patients who had referred in OAE, we will do better.
I request Dr. Sambhaji to felicitate Dr. Amulya.